Let me give you a update in regard to tracing. Tracing is run by 113 health departments around the state of Ohio. We are working very closely with them. We have extra tracers that we have hired and employed. They can surge in. For example, in Mercer County, we have some who are helping there, and some other counties. But one of the things that we've been trying to do is get better data. And so I was asked last week in a question to provide some additional data about contact tracing and the outbreaks and the stories and where the stories came from that we've been sharing. I've talked to our team at the Department of Health. Data related to outbreaks is frankly, under the current system at the Department of Health, not very easy to get through the Ohio Disease Reporting System or the Ohio Contact Tracing System. And let me talk a little bit about why that is, and then about what we're doing to help. Neither system was designed to pull data out. Neither system was designed to data mine, which we all just take for granted that we want to be able to do. And so I know some of my friends in the press have asked for information that we've not been able to provide. They may be frustrated. I am even more frustrated because I'm asking questions every day about where we're seeing outbreaks and information. And so the data systems that we have, one of the systems is 19 years old when it was designed. I'm sure it was state of the art then, but certainly is not state of the art now and does not do everything we want it to do. This is an example of, frankly, the decades underfunding of public health. And when this is all over, you know, as we look to the future, now as we look to the future, we've got to do a better job and frankly invest more in public health at the federal level, the state level, and at the local level. And my commitment is that we will do that, and we are doing that. The Ohio Disease Reporting System, for example, was designed to look at outbreaks by broad categories. Is it foodborne or is it hospital acquired? And not by setting. It doesn't index outbreaks based on the exact kind of business setting, such as a bar or a restaurant or a grocery store. It doesn't tell us that. That information is generally entered by local health departments in a field that isn't easily searchable, and it isn't always entered the same way. Consequently, we aren't able to pull a comprehensive list of outbreaks by specific setting. What we do is kind of bypass that system and go directly to the health departments and try to get as much information as we can about what is occurring and where the outbreaks are occurring out in the community. And you can tell every week when I talk about that, we've pulled some of that down. The stories that we talk about every week are anecdotal stories that we have collected from the local health departments. We know it's incomplete, but it does